The Health Professionals Council of South Africa introduced new tariff guidelines for the medical profession earlier this week. It should mean that patients will have some idea up front of what the cost of a particular treatment will be, unlike before. To break down what this all means, I'm joined by Clayton Samsodien. He's MD at Genesis Healthcare Consultants. Welcome, Clayton.
Thank you, Nampo.
Clayton, first of all, just take us back a little bit. How has it been that patients who are effectively medical consumers, how has it been that they haven't been given guidelines as to what they're going to pay for before getting treatment?
Yeah, well, if we could just go back into history, we'll know that in 2008, the Health Professions Council of South Africa, they scrapped the ethical drug guidelines. And the reason for that was because the practitioners adopted the National Health Reference Price List. But then in 2010, the NHRPL was deemed unlawful and couldn't be used by the practitioners. And since then, for the past 2 years, industry has been operating without any form of guideline as to what fee structures to charge.
Now that these new fee structures have been brought about, what do the new tariff guidelines say actually?
Well, firstly, it's now important that the practitioners must disclose to the patient up front what is going to be charged. In the event that the fee charged is in excess of the tariff, then the patient would need, or the consumer would need to sign a consent form. And we really welcome that sort of transparency, because there's no surprise in the treatment. You know, the HPCSA goes on to say that the consumer has now the ability to shop around, and hopefully that would breed some form of competition between practitioners in South Africa.
Now, you indicate that the patient needs to give his or her consent.
Yeah.
But now, what happens if you're in a real bind and you really need medical attention, but you're still being charged extortionate fees? I mean, what happens to those kind of professionals? They're still overcharging.
Absolutely. However, there are two little points there that has been communicated by the HPCSA. One is that the practitioner can obtain consent from the next of kin. Alternatively, if the procedure is that of an emergency, then the practitioner is allowed to carry on and, of course, charge the fee that they would charge. And that guidelines have been set in the communication.
So now, in what instances do you foresee that the I can't say the whole thing, but the Health Professionals Council, let's say, in what instances do you see them intervening?
Well, the origin of them bringing back the ethical guideline tariffs was purely because they couldn't adjudicate when a complaint arose of a practitioner charging exorbitant fees. So now they would be able to intervene and adjudicate, because there would be a guideline. And in instances where a procedure was done and the consumer wasn't made aware of the excess tariff, or a consent wasn't signed, then clearly the practitioner did not follow the guidelines of the HPCSA, and they could then adjudicate on that complaint. And that's when I think they would intervene.
How much does this decision coincide with us now being in the era of NHI? Is that going to be good for the NHI going forward?
Well, I don't really think it's got an effect on the NHI. I mean, up until this point, well, the important thing I must point out is that the guideline tariffs is applicable from today. So, you know, patients as from today need to know what their rights are, as we've just discussed. But from an NHI point of view, there hasn't been much comment. I don't see it having any impact. I do see that this is going to provide some guidelines for medical schemes, although they haven't commented as to how they would sort of change their rates of reimbursement. A lot of, or most of the schemes have their own rate of reimbursement in the absence of a National Health Reference Price List. So, you know, now when schemes have on their benefit schedules 100% of cost, you know, the question is that going to change now to the HPCSA tariff, or what tariff are they going to use? The general tariff that was used previously was up to 300% of the National Health Reference Price List. So, you know, I think the next couple of days are going to be important once we see how schemes react to the new tariff, particularly knowing that it's in effect from today.
Very briefly, Clayton, do you think that is going to bring into line rogue specialists?
I do believe that it would. I do believe that it's just going to make life a lot easier, even for us as consultants. When we advise medical aid members, we always have this issue between the rate that's charged, you know, a PMB issue, and the rate that the medical scheme pay. At least now we've got some guideline, and we really welcome the new tariffs.
Thanks very much for your time, Clayton.
Thank you, Nompu.
That was Clayton Samsodien. He's MD of Genesis Healthcare Consultants.